Welcome to Migrant Conditions Network's On the Move podcast, a podcast dedicated to providers and health advocates who work with vulnerable populations, including migrants and immigrants.
I just want to welcome and thank everyone for joining us today. I love these podcast episodes that we've been doing, and this is an occasion for me to talk to two of my favorite people in the whole world. My name is Eliana Garcia, and I'm the Chief Program Officer for International and Emerging Issues at the Migrant Clinicians Network. And I'm co-hosting this episode today, so I'll introduce my co-host in just a second. But just to let you know that my work at MCN has involved the development and expansion of programs like Health Network, which do case management and patient record movement for individuals who are moving across borders, state, county, federal, international. And we've been doing this now for about 26 years. And so that is one of the most fun things that I've gotten to do with MCN, but not the only fun thing. And one of the other fun things that I've gotten to do is work with my colleague, Alma Galvan. Alma, I'm so glad you're here co-hosting with me today.
Oh, Dale, I'm so glad to be here with you. And thank you for inviting me. I can tell you a little bit about me. I am the Director of Community Engagement and Worker Training at MCN. And I do a lot of things in MCN, but the one that I like the most is to think and craft interventions and educational materials using innovative and participatory approaches to build capacity among health service providers for immigrants and migrants communities and other underserved populations. And what we are trying to do always is aiming to decrease health inequities. So Thank you for inviting me.
Well, no, because that's at the core of what we want to talk about. And the person we brought on today is Sarah Price, who has been in partnership with MCN for a long time now. And she comes to us from the National Association of Community Health Centers. And this is going to be an opportunity for us to reflect on some of the work that we've done together. We've been engaged in immunization work, beginning from pretty far back, looking at HPV and moving forward. And then, of course, most recently, we've been doing COVID. And in all of that time, I think we've developed a really wonderful strategy for how we build on existing work that have, sort of usefulness in future topics, but they need to have the clinical content developed even further. So I want to introduce Sarah. Thank you so much, Sarah. You are, let me get this right, the Director of Public Health Integration at the National Association of Community Health Centers. I think, but what I know most about you is that you've done lots of technical assistance trying to help people integrate their public health understanding into their primary care mindset. And so you've worked a lot with the health center networks, and you've worked a lot with the primary care associations. And I think a lot of this comes from the fact that you're a nurse. And some of the best clinicians that we've ever worked with, sorry, don't mean any disrespect to the docs, are nurses. Because they bring so much of that really patient care, patient communication. Do you fully understand what we're doing? I'm not as busy as the person who's, running out the door. Let's take some time. And so you just introduce yourself for a second, Sarah.
I think you did it better than I could. Thank you, Del. My name is Sarah Price. I work at the National Association of Community Health Centers. But I didn't start there. I became a nurse because I only ever wanted to be one. I grew up actually overseas and saw community health at its best, at its core. That's how health is delivered in most communities around the world. And so when I graduated from nursing school, I said, let me go to the community. So I actually worked at a federally qualified health center in DC for 12 years, where I was doing patient education, staff education, some nursing administrative work. And then my journey actually took me to the National Association of Community Health Centers. So I've been now there for 6 years and really just spearheading projects where we were able to fund, not just funnel funding to entities like like different networks or community health centers, but also follow up with technical assistance and really convening. I always say I'm more of a convener than a technical assistance giver, right? I set the scene for folks to talk to each other and solve the problems, or come up with solutions in that way. It has been such a blessing to work with Migrant Clinicians Network and explore all sorts of different things, and then be able to kind of share and spread those learnings. So thank you for having me today, and thanks for working with me for 6 years.
6 years. And really, I mean, and the topic of our podcast is exactly what you were speaking to, which is the barriers to equitable health messaging. I think that, Alma has done so much work in language access. I think NAC really supported us so much in the cultural work that we wanted to do so that it would be particular to audiences, that the educational level was right. So those are some of the things that we want to talk about. But I want to give you the first word, Sarah, to just say, what is equitable health messaging?
Absolutely. I mean, that's a loaded question, right? You can go all sorts of different ways with it. But from what I've seen and learned both in my studies and as a practitioner in the field and now at NAC is equitable health messaging is co-designed with the listener, right? It's whatever message you're trying to get out there, what rings true to them in the way that they can hear it, in the way that they can absorb it, in the way that they can repeat it back out and tell it to others. And there's not one way to do that. There's not one message. There's not this. It has to really fit into that person's context, their life, their cultural situation, their gender, their, all those things. So it takes a lot, but I think there's so many aspects of that and so many good ways to do it. There's so many bad ways. The inequitable is where we get into trouble. So, and again, I think it occurs best when you're actually co-designing those messages or those, the ways to communicate with those listeners in that context.
I absolutely agree. So, one of the things that we always talk about is barriers to equitable health messaging. What are barriers that you see? And give us some thoughts on overcoming them. And then Alma, I want to come to you because so much of your work has been on health messaging. So, but Sarah, give us a couple of barriers that you've seen as you've been trying to mobilize folks.
Sure, absolutely. I mean, I think the first barrier is not co-designing, right? I think coming through and saying, oh, we have this, this resource that we tested with one community or one specific area of the population, this will work for everybody. Well, that doesn't land well, right? And in other communities. And what I think it doesn't just not land well. I think it causes mistrust and distrust and misinformation. I think we learned so many lessons about that in COVID. I actually was part of a different project where we actually went into communities, kind of via Zoom and talked to staff as well as patients who at that time, in the very early days of COVID vaccine, of why people didn't want vaccine. And we learned so much, right? It wasn't one reason. It was 10, 12 different reasons. And most of it was based on no one had ever asked them, or no one had ever really given the information in the way that, those folks understand. And so that was inequitable, right? When you just have one message, one way, that's not going to work either. So.
Yeah. And I think, Alma, part of my joy in watching your work is I think you really have seen a lot of good health equity messaging. And, talk to us a little bit about the work you've done and where you've seen it. And then we'll get to what might be missing, because there's always more that we can do. But tell us some about the work.
Yes, thank you, Del and Sarah. I totally agree with you, and all those, the co-design of the materials is something very, very important, and take in account the needs, the situation, the health literacy, the education, and all the different aspects of somebody or some community in order to think about reaching out. And then really, really grasp what is the core message, and then see what language they are using and co-create, co-design, as you are saying, that message. In one language, one concept cannot be translated. Maybe you will need to use a different way of situation, words. And you really, I think, is an art and a science. It's
Yeah.
both. Because you have to be very aware of what are the concepts that you are trying to transmit, but also the art of transforming and that message and something that will be significant for that person and that they can really use it. And I want to throw this concept here that we always talk about health literacy of the person that we are trying to reach. How we define this is the degree of which an individual can find, understand, and use information and services in the health system, in order to make good decisions for them and for their family and others. But we very often think about their health literacy and not the health literacy of the organization, health center, or agency that is providing that. And we do have a lot of responsibility in that. MCN is very aware of that. We are really, really trying to empower people to give that people or the service providers that work on those organizations and give them those tools so they can be health literate too and enable other people to be health literate. So I can start that conversation with that.
Well, and I think, and that takes us to the basis of the partnership, because, we have always benefited from the fact that Sarah and colleagues at NAC understood what we were trying to do. That clinically we had all of the information and we were willing to look for it. We were willing to investigate and get a good reading on it. But it was that we needed to have someone who would help us support the work we wanted to do, understanding that it wasn't just, oh, well, you helped us to do this, and so now we're going to translate it into Creole and Russian and, Pashtun or whatever, but that we were going to go into it with the clinical information that was right, and then really work to develop getting that information to the group. So Sarah, really, thank you all so much. And I guess what would be the best for us to talk about is a little bit of the background, how we did the COVID work. Because I can take you, Alma and I were back in Puerto Rico.
Yes.
With men on HPV, but I think we don't need to go too much further back than just the COVID work, if you would.
So we'll start with Sarah Price entered the picture because I'm sad I missed it. Yeah, I wasn't there for that. I came later. So we started this partnership together. I had actually heard of you all even before I came to NAC. So I joined NAC and just so folks know, so NAC is the National Association of Community Health Centers. So we're the membership and advocacy body for anyone who's a community health center, looks like one, feels like one, wants to be one, all of those. And so during COVID, and actually the year before, even COVID, we had been awarded through CDC funding to work on adult immunizations. Well, so if you remember, the year before COVID, adult immunizations was like very not well funded, right? Nobody really cared. It's like, oh, adult immunizations, whatever. And so we actually started, I believe, the year before COVID hits, Del. And what we looked at, we really wanted to look at kind of vaccine hesitancy and vaccine access. So it was kind of on the cusp of all that. And so we had reached out to you and as we really tried to do at NAC, say, who's keeping you up at night? Like who needs to be, kind of supported the most. And so the work that started there was actually originally in Texas, especially with, folks kind of, coming new into the country, really, tracking down who needs vaccines, and then can we follow them and make sure, they kind of get all their vaccines. So that was the partnership. I felt what was really interesting and what made you unique is Del and her team were part of a larger learning community. So we hosted a number of health centers and other networks. And so every month we would get on a call and they would report on, their initiatives within beautiful brick and mortar health centers and everything is just lined up so nice. And then Dell would get on the call and be like, well, I was in my car in the middle of Texas doing this and this. But it's so beautiful because there's a space for all of that, right? Immunizations are everywhere, and the need for immunizations and equitable access to healthcare is everywhere. So that's kind of where we started, with this concept of Migrant Clinicians Network was always kind of, outside the brick and mortar, right? Outside and getting to the people that maybe don't access or can't access healthcare in that way. And with vaccination as the lens, I think we always see vaccination as really preventive health. And so looking at, kind of all those other strategies. What did I miss, Del?
Not
Is
a
that
thing.
how it
You know
began?
what? You're making me laugh. And think. I mean, Alma, we're supposed to be co-hosting, and I'm just having a great time talking and asking.
No problem.
I'll turn it over to you. But really, Sarah, what's important to know is that my very first experience in understanding how you do this well in community was with Alma Galvan, and the work that she did with Voces Indígenas years and years before she even came to MTN. So, Alma, please, you start, have a little conversation with Sarah. I don't mean to dominate. I'm just really excited.
No, not at all. Not at all, Dale. I just want to point out that NAC has believed in the process, and we love, that you have been funding these processes to develop all this material and acknowledging with what Deliana has been done, a long time ago. I can just think about in 1992, she developed this video fotonovelas, on pesticides and other issues. And also in 2004, 2006, they start to develop in MCN with my help too, all these comic books, because we found that was a strategy to reach out that specific population that was coming from other countries, that was not reached for other people or hard to reach from other organizations, and they needed information. But in 2006, let me tell you that when with Texas Tech University Science Center of El Paso, they developed this material about vaccination. It was a series of comic books to inform about what to expect and how to care after getting an immunization or vaccination. It was geared to parents and to children. But MCN always have been thinking about the agricultural worker, the migrant that is coming to this country. So in 2006 is when Dell reached out to me. I was in the border already and working with indigenous communities, and a lot of indigenous communities that later on will come to the United States, to California. And we developed these focus groups to see, what is that they are afraid of? What is the concept that they have about vaccination? How we can reach out to them? And that allowed us to develop this calendar. It was a beautiful calendar for agricultural workers with a big tomato and with all the different vaccines, and explaining in a very simple and easy way, what is it? What is the disease that is fighting for? Where do you put it? When do you put it? Because we knew that males alone here in the United States were afraid of the injection. And they had a lot of misunderstandings about that. So we had that. 2006 was until 2020 when NAC allowed us to update that calendar. It was great. It was great because we incorporate COVID, and not only that, but allowed us to develop a comic book that was a complementary of that calendar. And it is amazing, has been amazing, because it is a very simple and useful way of reaching out to them and explain in more details. And it's a tool for the health provider to give it to them when they have a short encounter, and then they can follow up later on. we will talk later on about the community health workers, because I can talk, tons and tons about it. But I think it's the importance of the piece that I want to say here is that the process that allowed us to do that was in partnership with you, Sarah and NAC. And I think it's just a milestone in terms of materials developed for this specific community in different languages, because so far it's already English, Spanish, and my understanding is they are trying to do it in Creole and in Haitian. Yeah.
And I think Sarah and Alma, I think you'll know this as well. It's part of what I was trying to say before. You can find a lot of projects that are product oriented, but it's really hard to find support and gain people's understanding and commitment to process.
Right.
And I think that, Sarah, I don't know if we were sort of your first opportunity for that, but the process piece, I mean, if you wouldn't mind talking about that just a bit.
Absolutely. Yeah, no, I think, again, the work that we did together, there's not a project plan for that, right? There's not you don't write on a paper, this is what we're going to do and the product. And I think exploring that in this way, again, is also just part of a learning community. As we said, you all were always the outliers, but always brought the richness of this is how you co-design things with people. This is how you do this. And I think, the work that you all did, we were talking about first, in Texas, doing immunizations. You were then, updating the graphics. We then in later years, you all were in Puerto Rico and the Virgin Islands, and those were kind of initial conversations and work in those places, and you were able to make a video about that and all that. And I think, again, the process is you start with a relationship and you go there, right? You take it from that. You don't go in with a project plan and a checklist and say, okay, here's what we're going to do. With the communities that you serve, and so many of our community health centers serve, there's not a plan. There's not a process, right? And so you go and you say, okay, what's most needed in this community? You ask them, you talk to them, you say, what kind, how do you want to learn? What access do you need? And then you go from there. So that process of partnership development, I think in this work is so key. And the products come naturally after that, right? Everybody wants to, see some kind of outcome, and that's what comes of that. In talking with our funders, so all of this work was funded ultimately by the CDC, and they were just blown away by product. They're like, oh, we didn't even know that this could actually come of this. We're like, right, because it's not on a work plan.
But just the existence of the products, like Alma, the group in North Carolina.
Yes, I can tell you, we just published the comic book in, I think it was March 2024, so a few months ago. And so far, the North Carolina Cooperative Extension Program of the North Carolina State University already asked us for permission to print it out and put their logo, some text there, and print it and provide it to the farm workers where they are working. So for us, that's an outcome that we did not expect so soon. We know we have a lot of hope that a lot of different extensions, community-based organizations, and other agencies, Ventanillas de Salud, that people can use it, print it out, and give it to the people. And the good part of this, that you can edit that, and you can make sure or be part of the process by putting your health center, your information. I think the next step is maybe having a big pot of money to make a big printing. Maybe make a big printing and give it to all the health centers and document, what is an intervention with this kind of material, how much we can improve the knowledge about vaccination and the willingness to vaccinate of any of the vaccines that are there. So great.
Yeah. And I would have to say that this partnership, Sarah, and I think that you made the statement earlier that we started this where immunizations for adults was not interesting to anybody.
Yeah.
And part of the piece that we were working on was HPV. When they extended the age and we were trying to get people interested in having their children vaccinated or whatever. I don't know, Alma. I think that piece was really critical, and it impacted our work and really, I think, helped with our methodologies.
Yes, definitely. I think can I talk a little bit about the methodology? I think it is very important to have a team of professionals. We have an illustrator that knows how to transform or to do public health information into something simple. We have the technical people that have a physician, our medical chief officer, our communication department that knows how to do all that. And then the community that is reviewing the materials. So it takes us around 6 to 8 months to develop this kind of material. And during COVID, we had to update it like 2 or 3 times. Do you remember how the information came and was changing and changing? So we had to update it, and we can still update it now. But the part of it is that we were able to do it. We were not in a rush. We were in a partnership with you guys, and you allowed us to, move according to what was happening in the field. So it was great. So going back to the process, is this team, and then we have reviews of the materials. We know what are the core concepts. We do some drafts, we review it, incorporate suggestions, go and do it again, until it's done. So takes time, but
Sarah, did working with us change the way you work with other people at all?
Oh, absolutely. Absolutely. I think, again, I was familiar with you all even before NAC, but then really getting into partnership with you all and really seeing, again, your process, but your flexible process. Absolutely. I mean, I actually talk about our approach together all the time when I'm talking to health centers about, they want to do something new or they want to explore something. And I said, well, talk to the people first, right? Like you're trying to outreach to these people, talk to them first. How does that work? How do they want to learn? How do they want to, communicate and do that? And there's been several other projects where that's been the focus, and sometimes that's been the only focus. There's not been necessarily a very concrete product that comes out of it, but it's building up your partnership base. That's a huge one. Building up your stakeholders. Who are you listening to? Who can inform, the way that you work? And so sometimes that is the product, is relationship.
Right.
For sure. And I think where I sit at NAC, I'm also, on a lot of different, committees and stuff. There's some immunization, coalitions. And I feel like the work I've done with you, and then obviously, my role in representing health centers, I'm able to bring to those different coalitions that voice and that focus. Right. Yeah. To say, it's not about us. It's not our funding. It's not it's about the people that you're trying to serve and provide, equitable access to. Like that's the approach. And that's who, we should be funding. And that's who we should, be paying more attention to is folks. So yeah, absolutely. It's absolutely changed the way I've even, thought about some of our approaches.
Well, I have a question for you, Sarah.
Yeah.
Think about the other organization like MCN, a community-based organization that want to do something for the community, how they can engage with NAC.
Sure.
What do you recommend?
Absolutely. I mean, there's lots of different levels. So again, NAC is a large organization. We're the membership organization. And so what I always say is, if you want to start local, there is a community health center in most communities. So seeing who's in your community, who's providing those services. If you want to do, an approach and you're thinking, gosh, like my state really, there's efforts I'd like to see more statewide. There's primary care associations. That's a main role. And we we try to actually partner a lot with primary care associations because they have that reach for, the whole state. And so, approaching them and talking to them and they're just so valuable there. And then, at NAC, there's lots of different, opportunities that come. We do a lot of webinars and trainings and all like that. And it exposes you to a lot of the different intricacies and programs that both happen, kind of at a national level, but also community health centers. And in most of the areas and projects we do, we try to put the health center voice first. So our webinars will have health center people on them, and our conferences will, try to be that way as well. But yeah, to me, it's, sometimes just start small, find those partnerships in that community. I think, there's such magic in that, and community health centers need community partnerships, right? They can't do what they do alone. They're a healthcare organization, right? They don't always work in food or, other social services or enabling services, right? They rely on partners within their communities that understand the community as well. So lots of different opportunities, I would say.
Thank you.
That's great. But I think that whole message that you just delivered about starting first where you are with your community, I think the piece that you've both talked about in terms of co-creation, and that it can't just be your idea and then, your development and then the demand that the group accepted. And I think the piece that's really important too, and MCN has been exemplary, I think, in this regard, is to make sure that you are accurate, clinically, medically, thematically, whatever it is, that what you're providing is accurate. And COVID was such an interesting piece for us because the information was changing so rapidly. And I know, we were trying to put out a newsletter, and we would start it with what is known as of this date, so that you would know when the newsletter was updated. So working locally, finding those local partners, going to a health center, understanding that things need to be co-designed, being clear on who it is that you want to be working with, as opposed to believing that anything you do can then be used on a number of different populations. Did I miss anything? Did I forget something?
Invest in the process. Process.
Yeah, that's true. You're absolutely right. Alma, we want to wind up. You want to give us some information on resources?
Yes, I will invite everyone that is listening to us or watching us to visit our webpage. It's www.migrantclinician.org and search immunization or vacunación, English or Spanish. You can explore also our menu. There is a lot of different menus over there, and go to immunization, vaccination, or you can go to comic books and definitely you will see all that, or just vaccination calendar, or go to COVID, whatever topic you wanna approach, go there. Our website, I think, is great in terms that we are trying to do it bilingual and go to the point. If you want resources for community health workers, there. If you want resources for clinicians, there. So just go there, explore, engage with us.
Yay, absolutely. Well, thank you, Sarah. Thank you so much for taking the time to come on and be with us.
Oh, thank you.
You're welcome back anytime if there's something you want to talk about with us. Anyone listening can reach Sarah Price at sprice, Price, at nachc.org or nachc.com. But it's S Price. You can reach Alma at agalvan, AGALVAN, at migrantclinician.org. And you can reach me the same way, but just start with D Garcia at migrantclinician.org. So I want to thank you, anyone who's listening, for coming today, for listening to Sarah. Alma, you might have had more of an opportunity to moderate, but I just kept talking. So thank you so much for jumping in when I gave you an opportunity. But we would really welcome all of our listeners to come back and listen to other episodes in the podcast. We have a number of them that are available online, and there are certainly access to those resources is, as Alma was saying, if you go to our website, www.migrantclinician.org, and look for us. You'll find us there. Sarah, any last word?
That's it. Thank you for the partnership.
Alma.
Sarah, thank you very much for being with us. And Dale, always a pleasure to talk to you. Thank you.
Thank you, guys.
Thank you.
Visit migrantclinician.org/sign up to subscribe to MCN's news blog, get updates on new MCN podcasts and blog posts. Migrant Clinicians Network is a national nonprofit dedicated to providing practical solutions at the intersection of vulnerability, migration, and health. Donate to support our work at www.migrantclinician.org/donate. The content in this podcast is for general informational purposes only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Please consult official and/or federal sources for up-to-date health guidelines.